Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Bostix Titus issue. This audio podcast is part of Analytical Storm. This audio podcast is part of the SZtorm, and this audio podcast is part of a Storm Robotics production. This audio podcast there will be a basis in around sort of a summarization of the of the of this of the draft manuscript works that have been made up as part of this series, this audio podcast series. And so thus and so thus in and so thus in around some of the limitations of this works. Whilst topic tagging had allowed a good understanding of where gaps in healthcare education for patients could be bridged, the data highlighted only provides a snapshot, and so unfortunately, at the same time, only 6 tags were applied were applied and relevant to were applied and relevant to a theme that was referred to as education and interactive topic through the pediatric and young people's cohort, wherein there was wherein there was less than 1%, a 1%, a 1%. But this also highlights that education for peds and young people has been lost in transition over time. Topic tagging from 1 month per social media platform or more could have offered opportunity to identify more themes and conduct a more in-depth statistical analyses. In around the sort of summary then, until healthcare professionals are made available online, prompting education as part of health service, both literacy and healthcare remain somewhat disjointed. It is one important that education provision is provided in times where patients are seeking out answers to supplement healthcare, and two, it should be appreciated that without healthcare professionals being available online, peer support alone peer support alone potentially leads to misinformation. And what has also been intriguing is that one of the least prominent topics for patients from between both cohorts over the two-week duration was primary care. The last time primary care, for example, was a prominent focus through the adult nephrology an adult nephrology patient an adult nephrology social media platform was in 2014, where there were 12 tags, or 18 in around 18.75%, and 18.75%, or around, where 64 threads were tagged. 64 threads were tagged in around primary care for the adult in on the adult social media platform. And 2019 through the pediatric or young people's cohort, where there were 20 tags, or around 18.75%, and 64 total, 64 threads in 64 threads were tagged in total in context of primary care. So analysis further informs and substantiates primary care is not involved in care for patients in context of nephrology, and this further emphasizes it is primary care where further provision of educational support around CKD, for example, around chronic kidney disease, or nephrology and trajectory, is required. It has been construed that majority of investigations focusing multidisciplinary team clinics, for example, incompletely report clinical structure and function. Structure would be better supported involving allied health professionals, for example, on prompting educational clinics, online or otherwise, and wherein, for example, healthcare scientists, pharmacists, and nurses are involved in focus-based scenarios to help bridge gaps between language literacy and encouraging knowledge. Education needs to be measured and continuous to achieve best practice. Um, and some additional aspects. So some recommendation, and also what this and also a few points in around what this work adds. So the recommendations include educate. So number one, educational initiatives could be achieved through online multidisciplinary and group consultations involving patients, much like traditional face-to-face consultations. And consultation transcripts could be emailed and otherwise captured into a patient's electronic patient record. Number two, online educational support would also help integrate care and patients integrate care of patients and receive between pediatrics or young people and the adult nephrology cohorts. Uh, Number three, close to near 2 decades, the renal education for patient care has been improved, but at present, it is not uniform, mainly because CKD care between pediatrics and adults varies nationally. And number four, education should be integrated with patients' electronic patient record, and this would also help patients track and trace shared decision making. And in around what this work adds. So given that number one, given that patients are spending more time online to support uh, um, spending time online to support education and understanding of in around disease and trajectory, it stands to reason that should be an appropriate there should be appropriate co-produced educational modules to support healthcare. Number two, educational modules could help bridge gaps between different areas and understanding of disease and trajectory aspects aligned to disease trajectory. Number three, education initiatives could be provided uh, 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 through tech, but also including through audios, podcasts, and webinars, and telehealth facilities. And number four, educational support should be provided by trained allied health professionals and depend appropriate trained allied health professionals, and depending on online discussions, threads, and scenarios. The On social media, there will be references aligned to where viewers and listeners can check out some relating works to this series. And so with that, this draws this audio podcast close this. This has been an audio podcast as part of the Bostix Titus issue, audio podcast as part of an Analytical Storm, an audio podcast as part of the SZtorm, and an audio podcast as part of a Storm of the Bostix production series. Thank you.